Hello, my name is Tiffany Frere, and the career that I'll be discussing today is the one of the diagnostic medical sonographer. As a sonographer, I would perform sonograms, and sonograms are basically an image making machine that uses ultrasonic waves to make the image. And as a sonographer, I would typically be working alone in a dark room just with a patient. And this could be in many different settings. This could be in a hospital, working in like the ER or any other part in that sense. I could work in a clinic, or I could work in a private practice like a laboratory where other exams could be made, like other sonograms, x-rays, and things like such. And sonograms can be done on most parts of the body, the most common being the abdomen, like as an OBGYN, where the sonographer scans over the uterus and gets images of the baby, the fetus. This can help diagnose if there are any issues, prenatal issues, and problems can be solved ahead of time. Sonography is a great tool to use to help diagnose without having to enter the body. It's not invasive at all, and it can prevent or determine if surgeries are needed. And because of this technology, the rise of sonography as a field is growing roughly from 2014 to 2024, about 24%, which is a great amount. It's something that I know that in the medical field in 20, 30 years, when I'll be a fully functioning adult, I know that I can be doing, and I know that my job will be waiting for me. And this kind of job typically requires 40-hour weeks, just like any other. And sometimes this requires you to be on call. So this would typically happen in a hospital, if in any environment. So this means that, let's say, Saturday night to a Sunday morning, I might not be in the office, but if they need me, I would come in and perform the sonograms as needed. And the kind of education that something like sonography requires is typically a 2-year program. That's the route that most people go, simply because it's 2 years, you're one and done, and you can start working straight out the gate. Now, there are other options. There are associate degrees, which are also 2 years, bachelor's degrees, and some schools even offer master's degrees in sonography. These could allow you to specialize in cardiothoracic sonography, abdominal, and so on. Now, depending on the education that you have prior to you working, this will determine your wage. So the payment for sonographers is actually quite good. An entry-level job can get you started around $50,000, and Florida, being one of the lower paying states for this job, starts you at about $50,000. Places like California or Alaska can start at about $60,000, almost $70,000. Now, with a master's degree, you could be looking into $80,000, $90,000. And the way that I intend on planning out my career would be after my 4 years bachelor's degree in health sciences. I would enter this 2-year program after applying, and essentially 6 years after high school, I would begin my career. Now, this is a lot of schooling for a 2-year program, but this allows me to have a much more better idea of what the healthcare field is, and I would rather go in more prepared. And this could also help for me to get a higher wage because I have more education than the average person who's going in. Working as a sonographer has always enticed me because the job is one of low pressure. We see now during the COVID-19 pandemic, when it first hit in 2020, the healthcare workers were hit the hardest of everyone, especially nurses, ER staff, doctors, surgeons, and all those kind of frontline workers. All of them were hit the most, and their jobs became very stressful, working really long hours and putting themselves at risk to be able to help others. And working in the medical field is all about helping other people. And me personally, I would love to do that in ways that I won't be putting myself at risk. And I think a job like sonography would allow me to do so. It is low intensity, and I'll be able to do it under the conditions that I would prefer. Overall, sonography is a low risk, high reward field, one where I can help physicians diagnose issues if there are any, take preventative measures to avoid unnecessary surgeries or other kind of risks for people, whether it's fetuses or for themselves. And it's one that requires not too much education. That was one thing when going into the medical field I wanted to be very well aware of. Education is very expensive, and it's not something that everyone can go through. So it's a job that I know I would learn what I need to know, and I could perform it well doing so. And with years of experience, I think that it's something that I could really enjoy. I would learn all about the anatomy priorhand and learn new things on the daily, see new cases, meet new patients, and be able to perform in a job that I have always looked forward to. And this is why I want to be a sonographer.